hanging out with Cammy today. We are at NorthPointe Birth Center in this beautiful building that you tell me is only a few months old.
Yeah, our doors opened October 7th, and we actually started seeing clients on the 22nd of November.
So before we get to all the ins and outs of this building, where did the idea come from, and what was the need that you were seeing where you wanted to bring this to the area?
So the idea actually had came more than 10 years ago and just kind of came to fruition over the last 4 years when they had a town hall meeting at Beloit Health System, and one of the staff members had said, my sister is interested or had a hospital birth and didn't have a good experience and was wanting something like this in the area. So that's kind of how the idea of the birth center kind of was cemented.
So how is it different than having a baby in the hospital?
So a birth center is kind of a happy medium between a home birth and a hospital birth because it is supporting of the natural labor and birth process.
Okay.
Moms are allowed to come in, they spontaneously labor. Most of, we don't do inductions here at the birth center, so when women come into labor, they are actively laboring on their own. And they're allowed to be free of movement during labor and birth. We allow them to eat, we can do water births, all kinds of different natural ways to help promote the labor process. We don't do epidurals at the birth center. Nitrous oxide is the highest level of pain medication that we will give a mom here. But yeah, it's just basically supporting mom in whatever she's most comfortable doing in her labor and her birth process.
But it is still connected kind of sort of to a medical facility if needed? Is that the difference between doing this at home by yourself?
Yeah, so if in an emergency, we would transport to the hospital.
Okay.
Also, if moms decide that they need an epidural or would like an epidural, then we would transport them to the hospital as well for that kind of level of care, because that's something we don't provide.
So tell me about the different rooms that you have.
So we have 3 birth suites. They're all different themes. The first one we like to call the glam suite because it is a little more glamorous. There's some more sparkle involved in that room. The middle room is the modern suite, which is kind of more of that really home kind of cabin-y feel. And then the boho is kind of more of a whimsical feel.
It's relaxing in that one.
It is. I think all of them are relaxing, and everybody just kind of has their own niche of what they feel comfortable in, and they have their choice of birth suites when they come in, so they can pick whichever room that they feel most comfortable in.
And we kind of skipped the first question, which is all about you, Cammy, as a midwife. What do you do and what do you do here at the birth center? Yeah,
so I am actually a certified nurse midwife, and I'm also the director of midwifery services here at the birth center. A certified nurse midwife is trained. We're like an advanced practice nurse that specializes in normal pregnancy, normal childbirth. We also do women's health care, such as well body exams, birth control, and different things like that.
And you guys are currently accepting new clients who are probably going to see this and very much want to have their baby
We are, yes. We've actually been recently licensed by the state just a few weeks ago, and we're accepting clients up to 32 weeks at this point. So pretty much all trimesters.
Sure.
So yeah, we're excited to get some more clients in the door.
That's pretty awesome. So what would be the process? Just give you guys a call if you wanted to come tour and see if there's room for you in the schedule.
Yeah. So right now we're building the practice. So we aren't limiting the number of clients that we can have. Our goal for the first year is to have 100 births.
Okay.
So the more we can welcome in, the better. If you call the birth center, you'll speak with one of the nurses who does a quick risk assessment over the phone. And basically this is just a way to screen candidates that are appropriate for the birth center. Okay. So we deal low risk. So if you've had previous C-section, that's not something that we accept right now in time. We would like to, but there are other medical conditions that would risk you out automatically. So we go through that risk assessment right on that first phone call to see if you'd be a candidate to come in. Once we schedule, and we accept you as a client, then you come in and you schedule an appointment with the midwives, either myself or my partner, Jamie, and we just kind of tour you through the birth center, talk about your medical history, and go from there, and then you make that choice whether this is a place you'd like to have your baby or not.
All right, before we go, what's your favorite spot in this whole birth center?
I think, honestly, the fireplace.
Yeah, it's
for me.
Cozy
it's like really cozy, yes. Like we've all kind of parked ourselves there on the cold days and just kind of sat around the fireplace and did our work.
so pretty there. Game day is next on GDS. Taminique and I are going to test out our artistic skills, and I have a feeling we're going to make you laugh too. We'll be right back.